Good morning. It's 1027 and 1035 WICY, your feel-good favorites from the 80s and more. Wednesday mornings, right around 9:40 or so, we're joined by Matt Jones, who's with Hyde Medical Center. And Matt, you've been joining us now, it seems like every other week for the better part of a couple of months. And, I know you've been working hard. Tell us what's the latest so far and things, generally speaking.
Yeah, so generally speaking, we're still seeing the curve being flattened in our community, which is a great thing. I think one of the important messages that, I think that we want to get across as an organization is that we have to still be diligent in the work that we're doing, whether it be social distancing, wearing masks, things like that will help continue to keep our community safe and healthy.
What's going on in regards to circumventing hospital screening questions these days?
Yeah, so one of the things that we're finding a bit of is as we've opened up visitation within our hospital is that we are going through some screening questions for visitors that are coming through, whether those be friends or family members of patients that we have within our organization in our hospital. And we're finding that there are definitely some times where some of the questions that we're asking, whether they be travel-related questions or how people are feeling, sometimes they're not being truthful in those responses to us during the screening processes. What we're trying to do with those screening questions is really trying to keep our staff safe and also our patients that are within the hospital safe. We're trying to keep it a safe environment. So, sometimes with not answering those questions truthfully, sometimes make it difficult and can put our staff and our patients at risk of potential people that might have been exposed in areas that they've traveled to or how they're feeling currently. So, we're really just trying to ask for the community to be honest in their participation when we're going through screening questions for visitors. Just again, so we can make sure that we're here, we're a safe place to be, and that we're taking good care of our patients and our community.
Of course. A maybe brighter note, ALP visitation has begun, right?
Yeah, so actually just yesterday, Tuesday, we just started allowing for visitors down at our assisted living program. It opened up. We're allowed to have visitation. We're looking to do it between 9 and 11 a.m. Monday through Friday mornings, and we're allowed 2 visitors at a time. What we're doing for those visitation times is we're having 30-minute blocks that we're setting up for the residents that we're allowing the visitation. And then in between, after the 30 minutes, in between the scheduled times, we're taking 15 minutes to make sure that we're cleaning and wiping down everything and sanitizing everything. We are asking for the visitors to make sure that they're remaining 6 feet apart from the residents and also that they need to be wearing masks during the time. But we're definitely excited to be allowing friends and family members back in to visit these residents that that have been away from them for a while.
Yeah, this is a huge step right here. It's what a lot of people have been waiting for, but you really had to wait for the right time. You just got to be as cautious, right, as possible.
Absolutely. We're still being diligent. We want to make sure that the residents, especially at the Alice Center for our Assisted Living program, are put in safe situations. They're a vulnerable population, and we just want to make sure that we're taking really good care of them. Sure.
It's Matt Jones with us from Hyde, and I want to know real quickly, how did that presentation go last week that you guys did? Was it a webinar almost?
Yeah, so what we did last week is we had a virtual town hall meeting that we did through Zoom, and it kind of was a sign of the times right now, but it was very well attended, and there were some great questions that we got asked by community members, and I think it went really well, and I really believe that we will have another one probably in the next couple months as well, just to really touch base with the community and ask questions where we can.
Staying updated, Matt. I like it, my man. Thank you so much for your time, okay?
Appreciate it, John. Thank you.
All right. Always getting updates with Hyde Medical Center here at 1027 and 1035 WICY.